So if I were one of our patients that had a chronic health condition, a chronic disease, and I couldn't afford to go to the doctor, it sets people up to fail. It sets them up to not do well at work. It sets them up to strain relationships at home. It means they don't feel like getting out and being involved in the community. It just impacts every area of their life. If we don't give people an opportunity to get well, they cannot live the life that they need to live, much less the life they want to live.
It's so important that we start with childhood and developing healthy lifestyles, and walking and biking are activities that can carry on throughout your whole life. It is a culture shift. So many children now are totally car dependent, and so the walking school bus is a group of children that walk with adults that walk from school to either home or to a designated location where the parents can pick them up. And we've been successful at Dogwood Elementary School. We did start a walking school bus there this past March, and it did increase in numbers as each week we had a few more children until the end of school.
We help with life-saving dialysis transportation so that people can make it to their treatments 3 times a week, all the time, until they get a transplant. So some patients drive themselves, some patients just can't, some patients ride public transportation. So we see a lot of barriers regarding transportation and being able to even afford transportation to get there.
There's so many barriers in Knoxville to healthcare for certain individuals, and people with epilepsy are one of those groups. In Tennessee, you have to be seizure-free for 6 months to drive a car. So oftentimes that will prevent people from getting to work and back, to get to medical appointments and back, and even things that a lot of us don't think of, like the grocery store.
I think every place needs an interfaith health clinic. I think that we are one of the best kept secrets in Knoxville. That people who fall through the cracks, who fall in the gaps between the private sector with private third-party insurance or governmental assistance, that we are there to provide that bridge.
We're trying to work together to best meet the needs of those in Knoxville that are at a disadvantage to receiving the help that they need.
United Way has funded a Safe Routes to School program for Bike Walk Knoxville. And by funding Bike Walk Knoxville, we're able to reach out to other schools to just expand the program in Knox County.
It's important for us that the community supports United Way so that we can encourage our whole community to be healthier. It's one thing to say, be healthy, but it's another thing to help those who are in difficult positions who need that extra help. So that's what the United Way does, and that's why we're so grateful.
The United Way obviously plays a financial role in allowing us to provide these programs to help the people with epilepsy, but they do so much more than that. The United Way offers us trainings and opportunities to work with other agencies to try to best meet the needs of our clients.
I can't imagine what interfaith would be like without United Way. United Way has always made an effort to see that the people in this community were served and served well.